Hi, everyone. This is Chris from Affinity Home Care, and I'm here with Austin Adair from Affordable Home Care, one of our power partners. And let me like to start off by saying hello. How you doing?
Good. How are you, Chris?
I love the background. Looks
Thank
great.
you. Thank you. Yep, that's La Casa, I guess you could say. But yeah, appreciate you having me on. Again, I'm the owner of Affordable Home Care. Been doing home care myself for, gosh, I hate to say it, but 15 years this year. So
Yeah.
it's been a long, long time. Probably actually longer than that. My father started the company back in 1989, and pretty
Wow.
much grew up doing this work. It's in my blood. So
Yeah, I know right away when I met you, we had a lot of synergy. We were a family-owned business, and
yeah,
you're in it for the right reason. Your heart was in it.
I could tell the same. Yeah, you seem like you grew up in this as well. So it's
Yeah,
always nice to hear that.
Yeah, it's nice. That's why you're a power partner of ours, and we are always happy that we can provide that resource to our community, to you. It's hard to find good people that to work with, and
Yeah.
so you know how it is out there.
Yeah, especially nowadays with the whole pandemic going on. I think the healthcare industry has really got hit the hardest out of anything. I mean, well, I don't want to say anything. A lot of industries got hit really hard, but
Yeah,
it's been pretty tough for us. I'm not sure about you. How you been with finding the
yeah,
right folks to work with?
yeah. That's what I wanted to talk about with you, both of us, and we're both in home care. It's been a roller coaster ride, just starting up in the beginning and like a lot of the scare with the pandemic of having care professionals come into your home, and then family members stepping in and taking care of their loved one and stepping back, not receiving the care, and then family members wanting to go back to work in their daily life and realizing being the care professional was actually very difficult and that they needed home care. So we've seen those transitions where it's like they needed it and they didn't need it, and then
Oh yeah,
now they need it,
yeah.
and
I feel like
we
people are
see that
finally starting
too.
to go back to work now, and it's rush. They want to be able to get back to their old self, and they're stuck at home caring for mom or dad, and it's we've been getting a lot of calls for the need for help, but the one thing that's been tough on, at least on our end, is having enough people to provide the help. With everything going on, there's a major caregiver shortage. I've actually talked to quite a few agency owners myself, and a lot of them have been telling me that they've got the exact same issue going on. So it's not just like a
Yeah,
one or two companies out there. It's the entire industry right now has a huge shortage of caregivers.
yeah, it's so hard. And that's one of the reasons why we're both on here today to share with the public, is to let them know is that how um, important it is that there is a massive shortage of care professionals out there, and that if you are looking to go back to work and considering home care, now is the best time ever. Um,
Absolutely.
right? Like
Yeah.
the home
Yeah.
care has never been more prevalent than ever. And if you have the skill sets to be able to take care of your own loved one, and you're more than qualified to be a care professional. But I just
Oh
wanted
yeah.
to talk about another issue that I think we both are facing too, is that with the unemployment act that is going on right now. I know
Yeah.
that the home care industry, with myself and you, we've been hit very hard that a lot of our caregivers are at home not working. So
Yeah.
that causes, cause and effect, right? The family members
Absolutely.
are out there taking care of their loved ones, or there's a shortage in a facility, not enough care in the facilities.
Yeah, that's
And
why it's such a time now. If you've got a caring heart and you enjoy helping other people, you don't have to have done caregiving professionally. I mean, for a lot of folks, it comes naturally. If you have that type of personality, this is a great time to get into the business. There's a lot of incentives out there for caregivers right now, um, and it's a rewarding line of work. And honestly, doing home care is probably the safest place to provide care.
yeah,
Out of all the settings, hospitals, nursing homes, assisted livings, uh, any facility-based care right now, it's a scary place to live, and it's a scary place to work. But when you're at someone's home, it's just you and the client together. And I know you and I together, our companies, we do the right things and provide the right PPE gear for all of our staff so that we keep them safe. So it's a great avenue to go down if anyone's thinking about doing that.
Yeah. I mean, we're true believers of home is the right place, but also at the same time, if home isn't the right place, we're the best evaluators to decide that too.
Yeah,
but
definitely.
With the facilities now that are understaffed, I tell a lot of family members, if you can keep your mom and dad at home, and if you're not working, if you have family or friends or in your network, is try to find that daily routine to keep them safe and continue that care. But I think that a lot of families, I feel like over this time, have realized that being a care professional is hard.
It's not easy. Yeah. I mean, it's the same, the day to day. A lot of folks that need home care also need constant supervision, and that is something that throughout this whole process, I've seen a lot of families who try to do it on their own. And I can tell that they call me back in a couple of weeks, and it's like, I'm burning out. I can't do it. This is too much for me. I pay you guys a ton of respect because it is difficult. But the piece that makes home care work is that it's not just one person that's going to be taking care of mom or dad 24/7. It's a team of experts, and that's what really helps divide out that workload and keeps everybody level-headed and allows family to, I would say, take the caregiving hat off and put the daughter or the son hat back on. And
I say the same thing.
Yeah. Yep.
It resonates.
Yeah, totally. Yeah. Anyone that's going through the experience of having an aging parent, they want to be able to emotionally be there for that parent and not have to feel like they're being weighed down with having to do all the care and be a relative. It can be difficult.
Yeah, even in end of life care. I mean, the most vital time, and you don't want to have regret of not spending that time with your family. And I always I tell families that if you're looking for the time to be spent that's quality, is that you have to take the caregiver hat off in certain periods of time, and you have to take a break.
Yeah.
As much as you want to get the right care professional in there. Your parents also too. You yourself have to have a good quality of life as much as they do, and have a safe environment. It's just caregiver burnout's real. Family burnout is real. Right now I think at the highest amount it's ever been is that family members are starting to get burnt out taking care of their mom and their dad because they know that us providers don't have enough help.
Yeah.
So it's so important that we stress this to the community now is that, again, if me, Austin, and I, both of us, we're hiring and contact both of our companies. If you are looking to be a care professional, and we'd love to take you through that interviewing process so that way we can get the right care that you want. So I wanted to dive into about sharing your story about your company. Like affordable home care. What differentiates you from other companies that are out there?
That's a good question, Chris. We one of the things that we started when we first opened our doors in 1989, the only thing that we provided was stay-in home care, which is like where one caregiver stays around the clock, day and night with a client. And these are usually clients that are sleeping pretty well at night, but need a lot of help during the day. It's a perfect fit. And that means that one caregiver can usually stay for 7 to 10 days at a time, keeps the number of faces involved to a minimum. And especially for folks that have dementia, it's a really good fit because the one thing with dementia is that routine is key, and seeing the same people over and over again and establishing a routine that's really set in stone really helps manage that disease process really well. And the only care out there that can really do that excellently is stay-in home care. So we are truly the specialists in that realm. And we really didn't even start doing hourly home care, I think, until 1994. So we had plenty of years under our belt before we even stepped into what home care is mostly known for today. But we're still doing it. So it's one of the things that makes me feel good every day I come home is knowing that I can help folks in that capacity.
Yeah, I always say, like, whenever you do anything in work or in life, is that you have to find something that you could do in your most natural state.
Yeah,
And
definitely.
like, I think that's when you find what you love, what you do. You wake up and you continue to repeat that, every day.
Yep.
And home care allows you to be that way. I feel,
it's one of those industries where you can always feel good because you're actually helping other people, and I mean, not many people can go home and say that. So it always makes me feel good. I'm sure it makes you feel just as good too. So.
Yeah, I mean, it's in our reputation, in our community. I know my grandfather, I live in Commerce, and our office is in Commerce, and he moved here in the 60s when he was in his 20s. And, we pride ourselves in our name, who we are, before we even opened up a home care. So, reputation was instilled in my family and how important it was. So, having a company and being involved as much as you and I are, as we both are, and installing that type of mentality helps a lot for family members to feel comfortable about we're doing the right thing, and that's what's hard is that when you're out there trying to find other home care companies is asking the right questions.
Oh, absolutely. Yep. You got to do your research. I mean, there is no such thing as a cookie cutter home care company out there. And I think you and I both know that home care, it's not licensed here in Michigan. So it's kind of scary if you think about it. That means pretty much anybody out there can go open up a home care agency and state of Michigan wouldn't care about it. So it's pretty wild. But the folks that have been around the longest usually have figured out the right practices and how to do things the right way. I know you and I both are in that same category where we've been around long enough to really know the right from the wrong. And I always do business the right way.
Yep. And there's, and if you you concentrate on, there's a lot of things that happen in our industry that you learn from. I think that over the years, from the companies that did do, other families wrong, you learn, like, you don't want to be like that. You don't want to provide that type of service. And it's good for your employees to even share those stories with them because, like, they have to be in it and have the right heart in our industry because, it's not easy because we're asking to solve a problem every day,
Exactly.
And the caregiver that you're hiring is same thing. It's like they're solving a problem for a family member or improving their quality of life and trying to find the right care in their home. And you burden that as a home care owner and the staff as well. So sometimes it can be very tough in our job too. Be a lot of time and effort because we're not asking for, hey, we're selling flowers. It's like, we're getting very personal.
Yeah, it's very, home care is extremely customized. Like you said, it's not a product that you can just take off the shelf and use. I mean, you really have to understand someone's needs inside and out, and stay on top of that too. It's not just get things started and we're good, we walk away. It's you got to really be engaged with each client throughout the entire process. Make sure that we're tweaking their care as their needs change. And that's what makes me be able to sleep at night. I want to be able to sleep good, right? Doing good work is really allows that. So it's nice.
Yeah, exactly. By doing the right thing, it translates for the family members to build trust with you, and like being honest as much as you can. And you always got to communicate. And I think, like, with our patients that we see and our clients and that we get is that when there's something that does go wrong, they're more active understanding,
Yeah, definitely.
With that approach. So I'm going to dive into another question I have for you is if you were to give us an inspirational message for the community during these times of COVID and advice, what would you give to the community at this time?
My biggest thing is, seniors, those are the folks that helped us get where we are today. And they are the people that need our help more than ever right now. So if you have it in your heart to give back to the community, the best way to do that would be to help provide care for seniors, hands down.
Yeah, that's great. Yeah, and like we said in the in the middle of this is that if you are a care professional and you're looking to get into the industry, it's the best time right now to contact us and go through an interview process to make sure that, and if you are on unemployment and you're looking for work, right now I think is the best time to be able to apply for a good company to work for. I know, I feel like we have a waiting list currently right now. There are family members that are waiting for care.
Yeah.
And I know that for you, you get calls all the time, I'm assuming. Do you have a waiting list right now, family members waiting for care?
We do, and that's why I say it's a great time, because if you get into it, it's almost instant guaranteed work and very good hours, and it's not a long waiting period. I mean, it does take some time to get involved. So if you're on unemployment right now, that very well may be changing here in the next couple of days. So it's best to try to get that started sooner than later, so you're not sitting around waiting too long to get a paycheck. So definitely recommend it. And you can always go to, I'm sure you've got the link on your website, and our website too. We've got a link for our applications. It's at affordablehomecare.org. It's very easy. It only takes about 5 minutes. So.
Yep, and I know that some viewers have just joined recently, but I wanted to let you guys know, whoever just joined, is that we were just talking about how care professionals are at its low right now, but the highest amount of care that's needed has never been more prevalent in the home right now. So we're hoping that a lot of our care professionals get off unemployment and be able to get back to work and continue doing what they love to do and care for our seniors, because there's a lot of people out there that are taking care of their loved ones on their own. And so Austin Adair from Affordable Home Care, and can you give us your website and contact information?
Yeah. So website, again, it's affordablehomecare.org. And then our phone number, this is the main line to our office. It's 248-419-5010. Feel free to call if you have any questions. If you're interested in getting into the industry, we'd love to help facilitate that for you. And I'm sure, again, Chris, you're in the same boat. You'd love to help out in any way possible. If we can help each other out, I'm game.
Same here. Yep. Well, we're so happy. In the beginning, I was talking about Austin being a power partner, and I wanted to explain to everyone what a true power partner really is. So, for example, if I were to need home care services, that I wouldn't go and contact 4 or 5 other companies. I would call one company that I know that I can trust. And Austin is one of those power partners that I know that is on as in our network. We call that the Affinity Network, which is an exclusive membership of home health or healthcare providers that take care of the aging population in their home to provide them with education and resources. So Austin is one of our power partners. For example, if there was a territory that I couldn't cover, or there was a client that I couldn't take, that I would call Austin. And same for me too. I know that we provide home health care services, so that's covered by insurance. So if you need a nurse or need a therapist for exercises, we ask for always our power partners too, is that they think of just one company, not just multiple companies out there, of course. Now, and that's what is just support each other and guide each other and make each other. We want everyone to grow as a power partner. So that's why we have our live show here, and that Austin is very reputable company out there, and that's why I think that if any family members were to, I would have to direct them to you. That I know I feel very comfortable with it. And as the other power partners, you'll see the interviews that we have, is that they're individuals I know for myself that I have worked with over the years, not just somebody I just met. There's someone that I know that has been in business for a long time, has a good reputation, and is going to do the right thing. And that's what I think we all represent as power partners.
Appreciate the kind words there, Chris. Really do. And thanks for inviting me to your group, and much appreciated.
You're welcome. I hope you have a good day, and we'll talk soon.
Likewise. Take care.
Yep. Take care.
Thank you.
Yep. Bye.